An extradural hematoma, EDH, is a collection of blood between the dura mater and the inner surface of the skull, most commonly caused by trauma leading to the rupture of the middle meningeal artery, MMA. This is a neurosurgical emergency due to the risk of rapid brain compression and herniation. Causes and mechanism. Trauma. Typically, a skull fracture in the temporoparietal region tears the middle meningeal artery. Pathophysiology. The arterial bleeding leads to a high-pressure hematoma that compresses the brain, causing raised intracranial pressure, ICP. Clinical features. 1. Lucid interval. A classic feature. The patient initially loses consciousness due to the impact, regains consciousness, lucid interval, and later deteriorates as the hematoma expands. 2. Symptoms of raised ICP. Severe headache, nausea and vomiting, altered consciousness. 3. Neurological signs. Hemiparesis, contralateral to the hematoma. Dilated non-reactive pupil, ipsilateral to the hematoma due to compression of the oculomotor nerve. Seizures. 4. Signs of herniation, bradycardia, hypertension, and irregular respiration, Cushing's triad. Diagnosis. 1. Imaging, CT scan, gold standard, biconvex, lentiform hyperdense lesion. Typically does not cross suture lines because the dura is tightly attached at sutures. 2. MRI, occasionally used for detailed assessment if CT findings are unclear. 3. Clinical correlation, correlate imaging findings with history and examination. Management. 1. Emergency resuscitation, airway, breathing, circulation, ABC. Secure airway if altered consciousness. Manage raised ICP, elevate the head to 30 degrees. Osmotherapy, mannitol or hypertonic saline to reduce cerebral edema. Anti-seizure prophylaxis if indicated. Definitive management, surgical evacuation, craniotomy or burr-hole evacuation, performed to evacuate the hematoma and control bleeding from the MMA. Indications for surgery, hematoma, Henner 30 milliliters, midline shift 5 millimeters, GCS 8 or clinical signs of herniation. 3. Non-surgical management, considered only for small asymptomatic hematomas in stable patients under close observation with serial imaging. Prognosis. Early recognition and treatment are crucial for a good outcome. Mortality increases with delayed diagnosis or intervention. Prevention. Use of protective helmets during high-risk activities. Early assessment and imaging for head injuries.